Picture this. You're lying on a hospital bed. The lights above you are too bright, the room smells like rubbing alcohol, and a nurse is telling you to count backward from 10. 10, 9, 8, and then nothing. No dream, no darkness, no sense of time passing at all. The next thing you know, someone's saying your name, and it feels like 0 seconds have gone by. But when you look at the clock, 3 hours are just gone. Not blurry, not forgotten. On like they never existed. So here's the question that should honestly freak you out a little. Where did you actually go for those 3 hours? Most people think they know the answer. They think anesthesia is just a really deep sleep, a heavier version of what happens every night when your head hits the pillow. But that's not actually true. And once you find out what's really happening, sleep is going to look like a completely different thing. Because here's the strange part. If someone puts you into a normal sleep and tries to wake you up, you'll wake up. Shake a sleeping person hard enough, yell their name, and they come back. But under general anesthesia, you can cut someone open, and their brain won't even try to respond. Sleep is a state your brain chooses to enter. Anesthesia is a state that's forced onto it. It's less like falling asleep and more like someone reaching into your brain and switching off the lights in every room at once. So if it's not sleep, what actually is it? This is where it gets interesting. For decades, doctors used anesthesia without fully understanding how it worked. They knew the drugs kept people still and unaware. They didn't know why. It's one of the strangest facts in modern medicine. We've been safely erasing human consciousness for over 150 years, and we're still not 100% sure how. Let's zoom out for a second, because to understand this, you have to understand what consciousness even is. Think of your brain like a house with hundreds of rooms, and in each room, people are talking, sharing information, passing notes under the door. That constant communication between rooms is basically what creates your sense of being you. Anesthesia doesn't just quiet one room. It cuts the wires between all of them. The rooms are still there. The lights are still on in some of them. But nobody's talking to anybody else anymore. And that idea that consciousness depends on communication, not just brain activity, is why anesthesia is so much creepier than people realize. Because your brain isn't off. Scans show plenty of activity happening. It's just disconnected activity. Isolated conversations happening in empty rooms. But here's where things get genuinely unsettling. In extremely rare cases, that disconnection isn't complete. It's called anesthesia awareness, and it's exactly what it sounds like. A tiny percentage of patients regain some level of consciousness during surgery while their body remains paralyzed by the drugs. They can't move. They can't speak. They can't signal for help. All they can do is experience it. That becomes important because it reveals something huge. Anesthesia isn't one drug doing one job. It's actually 3 separate jobs happening at once. Unconsciousness. Amnesia, so you don't remember anything even if part of you is briefly aware. And paralysis, so your body doesn't move during the procedure. 3 different systems, stacked carefully on top of each other. And when even one of them slips even slightly, the results can be terrifying. Now here's the twist that connects everything. This blending of memory, awareness, and time is exactly why patients describe anesthesia as instant. Not because time doesn't pass, but because your brain isn't laying down memories during it. There's no footage to rewind. Your experience of time is built entirely from memory. And anesthesia hits pause on the recording, not the clock. Which brings us to an even bigger question that scientists are still fighting over. If your brain can be fully active, yet completely unconscious, what does that say about consciousness itself? Is it something your brain produces? Or something your brain simply tunes into, like a radio picking up a signal? Anesthesia is one of our only windows into that mystery, because it's one of the only situations where we can flip consciousness on and off like a switch and watch what happens in between. So let's go back to the original question. Where did you actually go? The honest, slightly humbling answer is nowhere and everywhere. Your brain kept working. Your body kept breathing. The version of you that experiences things that ties one moment to the next simply stopped being assembled for a while. Not destroyed, not paused like a video. Disassembled, like a puzzle someone gently took apart piece by piece, only to put it back together the moment you woke up, so seamlessly that you never even noticed the gap. And maybe that's the most unsettling and beautiful part of this entire story. Every time you go under anesthesia, you're not just sleeping through a surgery. You're taking apart the very thing that makes you you, trusting that science knows exactly how to put you back together again.